Performing a urine analysis. The first part of a urine analysis is the organoleptic examination. Pick up the tube with urine and mix by eversion. Note the color, smell, and appearance. Second part is the physical examination. Select the refractometer and clean the surface and lid with a clean tissue. Select a glass pipette and draw up urine and place 1 to 2 drops of urine on the glass. Without touching the glass, and close the lid. Read the urine SG on the appropriate scale and record your results. Clean the prism and the cover of the refractometer with a clean tissue. Chemical examination. Check the expiry date on the dipstick container. Remove the lid of the dipstick container and take up 1 dipstick and replace the lid immediately. Dip the dipstick into the urine sample for 1 to 2 seconds until all the reagent pads are wet. Remove the dipstick from the urine sample and dab excess urine on a tissue. Leave the dipstick lying flat on the laboratory bench on a tissue for 30 seconds before reading. After 30 seconds, hold the container in one hand and the dipstick in the other, and compare the color of each reagent pad with the corresponding one on the container. Correctly record results on the urine analysis form. Dispose of glass pipette, dipstick, and used tissues in the medical waste bin. Urine sediment preparation and examination. Place unspun urine sample in the centrifuge. Ensure that the sample is balanced. Close the lid and set the centrifuge on 1500 RPM for 5 minutes. Select 1 glass slide and clean it with a clean tissue and place the glass slide on a clean level area. Invert the centrifuge tube into an empty tube in 1 swift movement. Resuspension of the sediment should be completely avoided. Allow a few seconds for the urine to drain and then turn the centrifuge tube upright and resuspend the pellet with a few gentle taps in the tube. Add 1 small drop of Sternheimer Melbourne stain . Gently tap the tube a few times to mix the stain and the urine pellet. Insert a Pasteur pipette and allow capillary rise of the mixture into the pipette. Touch the pipette tip onto the glass slide to place a medium-sized drop of the mixture on it. Place a cover slip on the drop without lateral movement. Dispose of the pasteur pipette and use tissues in the clinical waste bin.
Stop.